All right. Good day, Dr. Michelle. How are you?
I am well. How are you, Reverend Charles?
I'm doing great, doing great. I want to, first of all, start off by saying thank you very much for taking time out of your busy day to do this interview. I know how busy you are during this time. So we're going to get right into the interview. To get started, just tell us a little bit about yourself, who you are and your background, just briefly.
Well, thank you so much again for allowing me to communicate with my home church. I really feel strongly that we need to be communicating from a religious sense about this virus that's going on. I'm a family physician, has been a family physician for over 25 years. My background is also in health policy and public health, which is why this time, this pandemic has been near and dear to me, because this has been my study in my master's and in my public health degree.
Okay, great, great. So we are in the middle of a pandemic. Just tell us what is coronavirus? What exactly is it?
I think the simplest way to describe what a virus, first we have to talk about what is a virus.
Okay.
Everyone's familiar with bacteria because I have a bacterial infection, sputum, it's thick, it's green. When you think of a bacteria, think of a basketball. When you think of a virus, I want you to imagine a golf ball. Okay. And when you think of that perspective, what we normally treat are bacteria. That's why you'll get an antibiotic. Whereas when you think of a virus, you'll have to get an antiviral medication. Every year, we get vaccines for the flu virus, the small size of it. The coronavirus is a virus for which we do not have a vaccine. Okay. So we were unable to prepare, like giving the flu vaccine. We did not have the corona vaccine, and that's why we're currently in a pandemic for more reasons than just that. We had no vaccine for prevention, and we currently have no cure to treat those who actually get the virus.
Gotcha. So share with us, how does the COVID-19 spread? How does it spread?
That's a great question, and it's an important question, and it's a question really that has been in what we call evolution. Initially, they said respiratory droplets, and that's the foundation of spreading this, which simply means when you're speaking, singing, talking, we constantly are spraying, if you could actually see it, what we call respiratory droplets. But when you sneeze or cough, you multiply 10,000 folds the amount of those respiratory droplets. Okay. So think of rain and think of being outside in the rain without an umbrella. Okay. So when you wear a mask, you're in many sense putting an umbrella up to prevent you from getting wet. Whereas when you walk outside without a mask and you're around people who are coughing, sneezing, you're getting rained on. Gotcha. Okay. So are there any other ways that the virus could spread? So that's the first way, respiratory droplets. So, and the reason I started with that is because you think of the rain and then the rain falls to the ground. And normally rains will just evaporate. But when you talk about a virus, because it's a living creature, that droplet is alive, so it stays present on whatever surface that it drops upon. So if it drops upon metal, wood, paper, your telephone, your glasses, your steering wheel, the shopping cart, it is live on that surface. So it takes a while, and they've estimated now anywhere from a couple hours on certain surfaces to 2 to 3 days, it'll stay alive on certain surfaces. Okay. So like aluminum, it'll stay alive for 2 to 3 days. So you take your hand and you then touch any one of those surfaces, and then take your hand, put in your face, rub your eyes, rub your mucous membrane, and we touch our faces more than 20 times a day. Okay. Now, the virus doesn't do anything just being on your hands. You actually have to put it into your body, and we do it when we rub our eyes, our nose, cough again. That's how we get it in our body. But just on your hands, it's not doing anything to you. And that's why hand washing is so important, because you get it in your hands. Gotcha. So, and can you get it while you're walking or
running. Let's say somebody sneezed ahead of you and you walk into that. Can you get it?
Most definitely. Again, if you go back to my analogy of the rain, even better yet, if you've ever driven up next to someone who has their windshield wiper on.
Gotcha.
And you're driving behind them. And they decide, I'm going to clean my car. And
yes.
they turn on the windshield wiper and you drive right behind them. Some of that windshield fluid ends up on your car.
Gotcha.
And that's what running behind someone. So I'm a big advocate for exercise. So do your best. Run next to somebody like on the other side, or keep a couple, as we would say, car length distance. Not just 6 feet, maybe 6 car lengths behind a person running.
Gotcha. Yeah, because I guess I was asking, how long does it stay in the air that way? That's what I was.
Right. Well, just like rain, it falls to the ground. All respiratory droplets are fluid, so it's going to fall to the ground. So for the most part, it's not going to just hover there like smog. Smog tends to sit, you know, but this is like rain. It actually falls to the ground.
Gotcha. So why should I get screened or tested? And what's the difference between screening and testing?
Great question, Reverend Charles. What people don't understand is that everywhere health professionals are doing screening, and they do it through questions. And there's actually a COVID app that you can do the screening questions yourself. Have you traveled to places that are known to have the virus? Are you having cold-like symptoms, runny nose, cough, fever, chills, loss of taste? Those are screening tools, those questions.
Gotcha.
Testing is when we actually take some kind of body fluid from you and look for your body's response through antibody testing or antigen testing. So you need actually body fluids to actually do a testing.
Gotcha. Yeah. Thank you. So who is most at risk for this virus?
First of all, it's really important that we understand that if you are ill yourself in any ways, you're at risk because your immune system is what protects you. Why are we at risk? Anytime your immune system is suppressed. So we look at individuals who are fighting cancer, people with autoimmune disease like lupus or scleroderma or any renal disease, or who have any kind of cancers will be at risk. But high blood pressure and diabetes that's uncontrolled puts you at risk. Asthma, anybody with respiratory problems, because this virus tends to go to the respiratory system. When I say respiratory, I'm talking about lungs, sinuses. So anybody who has chronic sinus infections, chronic lung disease are at higher risk. So they need to take more attention with protecting themselves.
Gotcha. Thank you. So we are currently quarantined in our homes and so forth. What can we do at home, at our house, at our apartment to best support a healthy household? Make sure everybody stay healthy.
I'm so happy that you mentioned that, because the first line of defense, the first line of support, and the first line of health begins in the home. Everything begins in the home. That's our first community. And you said that many times in many of the lessons that you've taught. We can't help a community at large in the city, in the state, or in this nation until our community, which is our home, is straight. And so the first thing you can do at home is follow the same protocols that is established elsewhere. Wash your hands. Wash your hands. Go to the bathroom and wash your hands. People coming into your home, make sure they hit the bathroom or the sink first and wash their hands. Avoid, if you're bringing objects from outside, make sure you wipe them down before you decide to put them on clean counters. Everything that you bring into your home, you should wash. And make sure you keep your hands out of your face, wherever you are, whether you're in your home. But for the home, look to one another and assess their health. Do your own screening, your home screening. Hey, baby, how are you doing today?
Yeah.
You know, say to your child, you okay? Take temperatures of everybody in the home. That's a great
Gotcha.
way, because a lot of people won't talk about it when they're not at their best.
Yes.
You know,
Yes.
they'll just crawl into bed. And if you are ill for any reason, stay in your room.
Gotcha.
Stay in your room. Self-isolate.
Right. So if you do happen to get a visitor to your house or apartment, should they come in wearing a mask also, or I mean, should they?
Most definitely. Definitely. In answer to your question, should a person coming visiting your home, whether it's your family member or a stranger, what we now know today, just since this weekend, lots of studies are showing there are three individuals at large. You have what they call no symptoms, not positive.
Okay.
You have people who have symptoms and are positive. And then you have people who are negative with no symptoms. And let me go over it again. You can have the virus positive.
Gotcha.
And completely have no symptoms.
Right.
And you will never have symptoms. You'll never be sick.
Right.
Millions of people every year get exposed to the flu and don't get the flu.
Gotcha.
Then you have those individuals, whether they're immunocompromised, has respiratory problems, will come in contact with someone who has been exposed to the flu. They didn't get sick, but because they are immunocompromised, they have asthma, COPD, diabetes, they now will become ill. So if someone comes to your home, keep that mask on.
Okay.
Make them wash their hands, because
Gotcha.
you don't know if they have the virus and they're asymptomatic and will never be ill.
Gotcha. And speaking of mask, what's the best way to use a mask, to put the mask on, take the mask off, and the same thing if you're wearing gloves? What's the best way to use them?
Well, the first way is definitely not the way I'm wearing it right now.
Okay.
I call it the bow tie method.
Okay.
I tease my staff, stop wearing the bow tie. That's meant to protect you.
All
So
right.
I'm alone in my office right now, so I don't have the mask on. But
Okay.
when I leave my office now and I'm going to be around other people, I'm going to hold it by the edge.
Yes.
And cover my face like this.
Okay.
And I'll never touch the inside, because the minute I touch the inside, I might as well throw it away.
Right. Okay.
So I'm going to put it on like this. I'll take the ears off and never touch the inside. And then when I put it on, and when I fix it, I'll make sure I don't touch the inside. Because the inside is what's going to contact your mucous membranes and your nose. So you never want to touch it.
Gotcha. So thank you. I appreciate that. So how about the outside? Can the virus get attached to the outside some way?
Oh, for sure.
Into your clothing and so forth?
Yes. If you think back to my rain example.
Okay.
If you walk outside in the rain, your clothes will get wet.
Yes.
After a while, it'll dry and it'll be dead.
Okay.
So for workers like myself, who are healthcare workers who are constantly around people, and I don't know whether they're positive or not, when I get to my home, the minute I walk in through my front door, my entire clothes comes off and I wash it, because I'm uncertain as to who I contacted at that day with anything. So I wash and I go take a shower.
Gotcha. So share with us about social distancing. What's the purpose of that, and does it really work?
Social distancing, people are really resistant to it. And I guess because we're social beings and we've been culturalized to hug and kiss and touch, and it's a sign of love, of caring and support.
Right.
And we're really asking people to do things that's against nature and culture.
Right.
But social distancing provides an initial barrier, which is distance, from infection. So if someone does cough, a simple cough, the distance they've anticipated is about 6 feet. So that gives enough room. But if someone coughs in your face, if someone even talks in your face, you sometimes can feel the spray of their body fluids hitting you on your face. So it provides a barrier that whereby those droplets will fall before they land on you. Does it work? It works definitely.
Right.
We're fighting, people are resistant to the distance, and it's really will save lives. That's how important it is. It will save lives.
Gotcha. So this virus appears to be hitting the Black community and other minority communities in a disproportionate way. Can you share with us why that is happening?
It's unfortunate, and I'm very sad to hear it as a public health student and one who's had my master's in public health. This is not new. Minorities in America, because of, let's call it as it is, racism in America, racism meaning treat one group of people different from the others, and minorities treated different, not just differently, but less than.
Okay.
Because of that infrastructure that has existed for so many years and we have not addressed it, we see where minorities have less health care. Minorities are living closer together with one another. Minorities do not have the finances and resources as a group, overall group. Of course, there are plenty of people with plenty of resources who are minorities, but when you look at the numbers, resource, access, living dynamics, and of course, fear. Many minorities are afraid to know the answer.
Okay.
I'm not going to I've had patients of mine say, I'm not even going to get tested because I don't want to know. One woman told me that she believes that minors are being sprayed with the virus.
Wow.
It's like they say in the Bible, they say, God sees fit to rain, the sun falls on everybody.
Yes.
This virus falls on everybody, but disproportionately, we're seeing numbers now finally where Blacks are representing over 30% of the deaths from the virus and only represent 14% of the population. Why is that? Same thing. Resource, number one, racism. Racism, which has created a disparity in access, healthcare, and trust.
Okay, got you. And maybe you addressed it a little bit, but can you just share how our cultural differences and practices affect the way that we process what's going on now?
Yes. For instance, example, we African Americans and even those of African descent cultures have a sense of distrust with much of healthcare because we were used to be experimented upon.
Right.
So sometimes there's a resistance and a reluctance to seek out the healthcare system early, unless you just have to because of that mistrust.
Right.
The second thing is we also deal with a lot of beliefs in home remedies, which work. There are many herbs and supplements that we've used because we didn't have access. So we utilize herbs, supplements, and so we've often, as a culture, go towards these herbal resources, rightly so. They do help. But we go to those resources first, and sometimes it's too late. And it does not help. And then you're in a place where you're far gone in the disease process that it makes it difficult to recover. So your culture, your customs, your access, and then the socialization. We get it together, we eat together. And so cultures that are very close-knit, it's very difficult to say, stay home, stay away, don't come by, don't visit.
Gotcha. So what can we do to kind of even the playing field, if you will, or is it possible?
The process, I think what we're doing right now is actually talking about the issue. We're looking at fourth month now of the coronavirus in the United States. And this is the first 3 weeks that they're really addressing the racial divide. The first 3 weeks after 30% mortality among minorities. And so we're finally verbally talking about it, sharing concerns about it, and now it's time to act upon it. We must break down those racial barriers. Discrimination must be removed and infrastructure put in place to equalize healthcare access and remove the fear and mistrust that have been in perpetuity because of the experimentation and the many things done to minorities in this country.
Gotcha. So beyond the physical impact, what are some of the broader health impacts that this pandemic is having on our community? Not just the Black community, but the community at large.
I think the biggest thing, and it was my concern when I posted the first video on my Facebook and Instagram, the biggest concern I had, and it has come to fruition because I see it in my practice, is fear. I don't like fear.
Okay.
And fear caused people to treat people in ways that I believe is not the way we are taught to treat people, with kindness, with gentleness, with care, with consideration, with understanding. Get away from me, move aside, stand back. Don't you know it's 6 feet?
Right.
Yes, where it should be offering. I'm seeing it erode. So it creates fear, anxiety, nervousness. Our psychiatrists and psychologists are hard at work because so many people are afraid. So what do you do with fear and anxiety? You combat it with what you're doing here, Reverend Charles: knowledge, information.
Gotcha.
Use the armor of knowledge to squash fear.
Yes.
You understand, and you can trample any fear that you might have. Know this virus. Come to an understanding of how it's transmitted. Learn how to protect yourself and your family members, and stomp all over fear, and always treat everyone with love and understanding and kindness.
Yes.
So many people are dying, and young people, middle-aged people, older people. Be sympathetic, be empathetic, be kind, be considerate. Make a phone call, reach out to those who are isolated just to say hello, because they're in isolation.
Yes, so true, so true. So how will we know? I know we don't have a cure right now, but before we get to cure, I don't know if this is possible, but how will we know it's safe to come back together in our schools, our churches, our businesses, and so forth? When will it be safe?
I believe, and Reverend Charles, you said it this past Sunday, and I was happy to hear it. We are in evolution. This is an evolutionary step. And then I would even add revolutionary step.
Yes.
We are changing and evolving, and coming out of this pandemic, we will be different. How we engage, how we socialize will be different.
Yes.
In answer to your question, when will it be? I think we will always and should always maintain the foundations given in kindergarten. Wash your hands every day. But in addition to the foundations of washing your hands everywhere you go, I think when we do go back, the government will tell us, both our Governor DeSantis as well as the man up there, our president. He has hopes, but
we're praying for him.
The public health goal is that everyone will be tested and will identify all the people are infected. And once we know everyone, that's not going to happen. So when we do are allowed to go back to work, we should maintain certain distancing. We should still maintain wearing our mask. We should still maintain washing our hands and keeping our area clean.
Yes. So are you describing a new normal, perhaps, when we do go back?
Yes. I see we will have an evolution as to how we engage in the social world.
Gotcha.
Yes. We may do it. They may like our Asian brothers and sisters. And
namaste. Yes. Okay. Well, we almost finished. Got a couple more questions for you. So what are some of the most dangerous myths surrounding COVID-19? Like I've heard for a while circulated in the Black community that Blacks could not catch this disease. So what are some other myths out there that's circulating out there about this virus? I think that myth came about, and even crossed my mind, why aren't Blacks getting this disease earlier on? And what we now found out, the myth coming to fact, is that the data was not released. Gotcha.
It was not collected and it wasn't released. So it appeared as if Blacks were not getting it because they were not releasing the data. So because of that, many Blacks said, well, I can't get it, so I don't need to wear a mask. I don't have to extra wash my hands. I don't have to keep safe distance. And that was very dangerous to us. Other myths that came out, just drink hot water, hot tea, soup, have some ginger, and the heat will kill the virus.
Yes.
Keeping warm will keep the virus.
Gotcha.
Unfortunately, this virus doesn't care about heat. You know, it really doesn't, because it's not going to your stomach, it's going into your lungs.
Gotcha.
It's going to your respiratory system.
Yes.
So warm, cold, you know, it makes you feel better. It'll help your symptoms.
Right.
You know?
Right.
But as far as eradicating the virus, that's not what warm food, warm soups is going to do. That was a great myth. Another wonderful myth that other people were, it's very interesting, is that they talked about Black people. They talked about the mask. People are wearing masks, and I found it very interesting. They've come out with scarves. They're coming out with shirts. And the biggest myth is, if I wear my gloves and my scarves, then I'm protected.
Right, right. Yes.
But if you don't do it right, you know, the right thing in the wrong way is still wrong.
Yes.
Putting your hands on the inside, taking your dirty gloves, I'm putting it in your face, touching your glasses is still wrong.
Gotcha.
So having the gear is not going to stop you from getting the virus if you don't use it properly. That's a big matter.
Gotcha. I got you. Thank you. So where can we go then for accurate information, to get accurate, current information? Where can we go to trust it?
You see me pause.
Yes. I mean, can we go to the CDC website or what? I mean, where?
Yeah. Well, let's. I'm going to remove the word up to date.
Okay.
And I even removed the word accurate. What I will say, you can get information about the virus to the point where you read it, where you're reading it. So as current as possible. The CDC does have explanations. The World Health Organization has posting on their website, but that information is as good as what they've released and when they released it.
Okay.
I removed the word accurate because every minute, every hour, someone is dying and getting infected. So you'll never have an accurate count.
Gotcha.
Up to date, it's as up to date as they can print it and write it.
Okay. Okay.
So I will just say you can get information there.
Gotcha.
CDC and the World Health Organization, and even the Florida Health Department, you can get information.
Right. Right.
Is useful.
Gotcha.
That's what I would say. It'll be useful.
Okay. Gotcha. So just two more questions. One, as a woman of faith, as a truth student, how do you reconcile, and this is not just dealing with the pandemic, but in general too, your faith with science and to navigate your life?
As Martin Luther King said, you know what he said, science is not in opposition, to faith and God. We're complementary. In fact, I believe God is under all things. That's how that's my teaching and my belief. And I have nothing to reconcile. And the only thing I know, because God is in everything and in every direction, I do the work I do because that is my calling to teach and to teach on health and wellness. And people say, well, how can people be dying? This is a virus. This is an animal. This is a living organism who's trying to live too. Okay. And we happen to be his source of food or their source of food. It's not in opposition to my belief in God. God created everything. And so when people say, well, may abandon God because God is not, or took their parent with the coronavirus, or
Correct.
This is not a God issue. In fact, I would say this actually asks us to work the teachings of prayer, of understanding, of love, of caring. It is time for us to demonstrate our belief in the evidence of God.
Amen.
In fact, I'm so much at peace knowing that in service of one another is what we're called to do. And this is a perfect opportunity for us to stop playing video games and stop watching movies, to be in service of one another and in the teachings of what we're taught in all religion.
Amen. Amen. Okay, to turn to each other instead of away from each other.
Exactly.
Yes.
We may physically move away, but we can spiritually come together.
Amen. Amen.
In consciousness and mind. And what you're doing with these video chats and the sermons via video, we are collecting the consciousness. And God is everywhere. So collecting the consciousness does not stop us from being religious. We don't have to be collectively in a room.
Yes.
We can be in spiritual mind as when we do video conferencing.
Amen. So last question. What's one thing you want everybody to walk away with is to be able to come out of this healthy and whole and more powerful than when we started with this? What's one thing that we can all do?
I believe that what people forget, and I said it on my Facebook, after every winter is spring.
Yes.
And after every rain is sunshine.
Mm-hmm.
And when the ark stopped, the water receded.
Okay.
Life and life grew abundantly.
Yes.
There will be spring and summer again.
Okay.
And we need to focus that is only for a time.
Amen. This too shall pass. Yes.
Always. And will end with sunshine and life.
Amen. Amen. Okay, Dr. Michelle, I really, really appreciate you taking time out of your busy day. I'm going to let you go. I know you need to have some lunch before you get back to your practice. Thank you very much. Stay healthy, stay safe, and know that we appreciate and we love the work that you're doing. Thank you for the work you're doing in the community. We appreciate you.
Thank you. And if there are any questions, they can call my office. And you can post my phone number in case anyone has any questions or concern.
Will do. Do you want to just tell the number right quick? Share the best number?
They can reach me at 305-948-4701.
Great.
Be well.
Namaste. Thank you.